UK political parties make very bold promises about healthcare, but do they stand up to scrutiny? We examine their promises using evidence-based journals. Today's video looks and comments on an article in the BMJ Election Watch. How credible are the main parties' pledges on the NHS? And examines it in light of what we are seeing in Britain today. What are the party's headline promises on health? Labour Party. The Labour Party is focused on training thousands more GPs, guaranteeing face-to-face appointments for all patients who want them, and delivering a modern appointment booking system to end the 8 a.m. rush. They aim to reduce waiting lists with 40,000 extra appointments, scans, and operations weekly, clearing the backlog of patients waiting over 18 weeks for consultant-led treatment of non-urgent conditions within 5 years. Additionally, Labour plans to hire 8,500 new staff to improve mental health care for children and adults. Conservative Party. The Conservatives promise a significant increase in the NHS workforce, aiming for 92,000 more nurses and 28,000 more doctors by the end of the next Parliament. Liberal Democrats. The Liberal Democrats want to boost the number of full-time equivalent GPs by 8,000, half through recruitment and half by retaining experienced GPs. They claim this will ensure everyone can see a GP within 7 days or within 24 hours for urgent needs. How do they propose to achieve this? Labour Party. Labour plans to have NHS hospitals perform more operations and diagnostic tests during evenings and weekends, incentivising staff for extra appointments out of hours. They intend to fund these initiatives through a crackdown on tax avoidance and closing non-domiciled tax loopholes. Labour also aims to alleviate pressure on general practices by improving access to services and treatment through new routes like community pharmacist prescribing and expanding self-referral where appropriate. Conservative Party. The Conservatives' health investment plan includes $6.6 billion for the NHS and $7.5 billion for adult social care over the next 3 years. They plan to save on NHS management costs by employing 500 fewer managers, freeing up £550 million for frontline services and saving over £640 million on management consultancy. Liberal Democrats. The Liberal Democrats propose improving doctor recruitment and retention through a properly independent pay review body, a 10-year retention plan making flexible working a right for NHS staff from day one, and expanding access to flexible, affordable childcare. They also pledge additional funding to support GP services in rural and remote areas. Are their ambitions achievable? Labour Party. While Labour's ambitions to reduce waiting times, improve GP access, and reform social care are welcomed by health analysts, there are concerns about the lack of detail on implementation, funding for hiring and training more staff, and addressing NHS retention issues. Sarah Woolnough from the King's Fund noted that similar approaches had seen success, but scaling up would require sufficient staff, which is uncertain given high stress and burnout levels. Conservative Party. The BMA expressed doubts about the Conservatives' ability to meet their recruitment promises without detailed plans for retaining doctors, especially regarding pay. The NHS Confederation warned that cutting 500 managers might save money but could increase the paperwork burden on clinicians. Professor Azim Majid emphasized that NHS managers play crucial roles in planning services and managing budgets, suggesting that cuts could disrupt rather than improve services. Liberal Democrats. Recruiting 8,000 more GPs is seen as a laudable but challenging target. Sarah Woolnough stated that without more detail on achieving this goal, the promise of faster GP appointments is hard to envision. Have past promises been delivered? In 2019, the Conservatives promised 6,000 more full-time equivalent GPs by 2025, a target that was not met, leaving the GP workforce in a precarious position. However, they did achieve their 2019 pledge to employ 50,000 more full-time equivalent nurses by 2023, though the percentage trained in the UK has declined. Previous targets, such as the 2015 pledge by Jeremy Hunt to recruit 5,000 extra GPs by 2020, were also missed. Experts' verdict. Thea Stein from the Nuffield Trust argued that none of the main parties' NHS spending plans are credible, suggesting that the proposed increases would coincide with the tightest funding period in NHS history. Professor Azim Majid highlighted the challenge of achieving workforce and access targets amid severe public sector financial pressure and competing demands for increased spending. He noted that extending prescribing rights and expanding pharmacy-first programs could help, but might not significantly reduce GP workloads without proper integration and support. Thank you for watching today's video. Please like, share, and subscribe to support the channel.